Hi everyone, this is Dr. Sam. Today I'm going to move on to my next mental health topic. The focus of today's presentation will be on depression. As usual, before we proceed, please kindly review my disclaimer. The target audience for this presentation may be for anyone who is affected by depression or their loved ones. Number two, as a general education for the general public. Number three, for medical students learning about the topic. And lastly, for anyone who is interested in the topic. Before I proceed to discuss about what depression is, I just want to quickly define what health is. According to the World Health Organization, uh, health refers to a state of complete physical, mental, social well being, and not merely the absence of disease. This seems like a really high standard definition of health. You see, a state of complete physical, mental, and social well being, and not merely the absence of disease. A very high standard definition here. Next, we will define what mental health is. Mental health refers to our emotional well being, psychological well being, as well as social well being. Emotional well being means how happy or how good we feel. And psychological well being refers to how healthily we think, how balancedly we think. And social well being means how we act healthily in a social environment. And how we think, how we feel and act in social environment in turn determine how we handle stress, relate to others, and make healthy choices in life. Next, I will move on to discuss the attributes of mentally healthy children. Based on my observation, okay, I am very impressed by a lot of the good attributes that I see in mentally healthy children. Those are the good quality words, okay, that can be used to describe these children. They are happy, they are more happy, they are more keen, more energetic, more enthusiastic, they're more interested, they joke more, they laugh more, and they make more friends. These are the um, positive descriptive terms or adjectives that we can see clearly in the attributes of mentally healthy children. Indeed, I myself feel very impressed by what I see in children because they are not limited by the so many rules and regulation that we adult experience and have to follow because of the way our society is run. Next, we will also discuss a little bit about the attributes of mentally healthy adult. Based on my observation about a lot of uh, what we call successful and healthy adults that I interact with, I can see that these people generally report a greater sense of well-being, feeling more positive, feeling more motivated, more passionate about what they do, able to cope more, perform better, experience less anger and resentment, and behave more patiently and understandingly towards other people. So these are the attributes of healthy adults. Again, these are the attributes of healthy children, mentally healthy children, and these are the attributes of mentally healthy adults. Okay. In contrast, in contrast to the optimum healthy state that we all would like to experience, unfortunately, life is not perfect. At some point in time, we will experience sadness because of something that is unfortunate in our life or not ideal in our life. As you can see the picture on the right, they are very contrasting to the picture on the left. Okay, and the story of sadness is usually written all over the face of the person as they go through difficulties in life. And this leads us to our main topic of discussion today, which is depression. Depression is defined as a change from previous normal healthy functioning for the worse during the same 2 weeks period, with the diagnostic criteria of 5 or more of the following symptoms. So when you go and see a psychologist and when you go and see a psychiatrist and you ask them, do I have depression? Okay, they will actually use this list to decide whether you have depression or not. And they will qualify you as a depressed patient if you have 5 or more of the following symptoms. The first one is feeling of depressed mood, which essentially refers to a pervasive feeling of hopelessness. This first criteria must be present. And number 2 is the loss of interest or pleasure in what we are usually interested in or what we find pleasure in everyday life. This second criteria must be present too. And the third criteria is a feeling of worthlessness and or excessive inappropriate feeling of guilt. As you can see here, the first 3 diagnostic criteria used by psychiatrists or psychologists to diagnose a person as having depression or not are actually subjective feeling experienced by the patient. Okay? They are very subjective feeling. The next 2 diagnostic criteria are insomnia or hypersomnia. Number 5 is weight loss or weight gain. As you can see, these 2 diagnostic criteria are observable change, physical change in the patient, as observed by a third party. For example, your father or your mother can tell you that you are sleeping more than usual, or not sleeping, or you have gained weight or lost weight, which are actually physical changes that can be witnessed by someone other than yourself. The next 3 criteria are what we call diagnostic features of the loss of ability to function in everyday life. The number 6 refers to a feeling of fatigue or tiredness. Number 7 is a feeling of decreased concentration, and number 8 is psychomotor agitation, which is feeling startled very easily, or psychomotor retardation, which is just getting really slow, doing things really slowly, loss of activeness in the person. And lastly, is the thoughts of death or suicide. So as you can see here, the 9 diagnostic criteria of depression is actually split into 4 different groups. The first 3 are the subjective feeling of depressed mood, loss of appetite or pleasure, or feeling of worthlessness or excessive guilt. And the next group is observable features, physical features that accompanies the subjective feeling. And number 6 and number 7, which is number 6, 7, and 8, which are the third groups, refers to the loss of ability to function in everyday life. Lastly, number 9 is the feeling of death or suicide. I will now quickly go into a little bit more in depth about each criteria, just briefly only. So criteria number 1 refers to depressed mood. As mentioned earlier on, it is a persistent feeling of sadness, emptiness, or hopelessness, that manifesting behavior, facial expression that can be observed by others to be frequently sad, negative, hopelessness, sad, negative, hopeless, or tearful. In children and adolescents, this can be just irritable mood that is pervasive. That happens most of the day, nearly every day, and maybe just subjective only, which means that it is something that a patient feel but may not be observed by others. Okay, so this is number one. Next, we have got number two. Number two is the loss of interest or pleasure. It's marked by a diminished interest, pleasure in all or almost all activities that usually interest a person. And again, it has to happen most of the day, nearly every day, maybe subjective or observed by others. As you can see here, the criteria have to happen most of the day and nearly every day. And number three, the feeling of worthlessness or excessive or inappropriate guilt, again, has to be present nearly every day, whether the guilt is real or not real. Delusional means that it's not real, it's just some story made up in the patient's mind, and he is convinced that the story is real. And we already mentioned number four and number five, insomnia or hypersomnia. Again, they have to happen nearly every day, every day. Number six is fatigue, loss of energy, nearly every day again. As you can see, every criteria is accompanied by nearly every day or all day. Number seven, again, decreased concentration nearly every day. The decreased concentration may be just indecisiveness, inability to make decision. And number eight, psychomotor agitation or retardation, getting easily started or getting really slow in his bodily movement or her bodily movement. They have to happen nearly every day again. It has to be observable by others. And lastly, the patient also have thoughts of suicide or death, which can be recurrent. Recurrent, which means it happens again and again. However, these suicidal ideation are usually not accompanied by any specific plan or suicide attempt. They are just passing thoughts normally. But obviously, there are exceptional circumstances where the patient may have plan and action in place too, which are red flags that we must pay attention to. Finally, I want to quickly contrast the difference between depression and sadness. Unlike depression, which is refers to sadness to a greater extent, to a greater degree, it means that it is a sadness, a deep sadness, as well as a broad sadness, resulting in total lack of happiness and total lack of interest in almost everything in life. Sadness is to a less extent as compared to depression. It is a common emotion in everyday life. It is part and parcel of our life. It is usually a reactionary emotion, which means that it is reactive to something external that we all will experience some point in our life. It is usually caused by a specific external situation, a specific person, or a specific event. For example, the loss of a job, the end of an important relationship, the death of a dear one, a loved one, what we call bereavement, uh, a serious medical condition, a financial ruin, or significant other losses. So sadness is usually triggered by one of these. With sadness, the person usually experience only, a feeling of um, sadness for a couple of days, maybe, a week or so. But then the person is still able to enjoy everyday activity like watching TV, enjoying his or her favorite food, spending time with friends, sleeping as usual, and will still feel motivated to go about doing other things in life and maintaining a good appetite or desire to eat. And also, as compared to depression, in sadness, a person may experience regret or remorse for something that he or she has said or done, but there is usually no permanent sense of worthlessness or guilt, as is the case with depression. And finally, self harm and suicidal ideation don't arise from non depressive sadness. Okay. So in summary, depression has got 9 diagnostic criteria. 9 diagnostic criteria. That is split into 4 different groups. Into 4 different groups. Okay. The first group is subjective feeling of depressed mood, loss of interest or pleasure, which is number 2, and number 3, feeling of worthlessness. These are subjective feeling experienced by the patient. Number 4 and number 5 are insomnia or hypersomnia, weight gain or weight loss, which are observable change in the physical state of the person. And number 6, number 7, and number 8, which are fatigue, decreased concentration, and psychomotor agitation or retardation, respectively. There are symptoms of impaired ability to function in everyday life. Lastly, number 9 is the thoughts of death or suicide. I hope this presentation has been helpful in helping people to understand the diagnostic criteria for depression. Okay. And finally, okay, if you or anyone you know suffers from depression, there is always education, hope, and help around. Please make sure to contact your GP, psychologist, psychiatrist, holistic healthcare providers, or even the emergency department if you feel that there is an urgent crisis for immediate assessment, diagnosis, and treatment plan. Thank you very much for watching my video. I hope this presentation has been helpful to anybody who is interested in the topic. Okay, and I want to acknowledge the following resources that I have used to prepare this presentation, as well as these resources which I have used for my pictures in this presentation. Thank you very much for watching my video. I hope you have enjoyed this presentation. If you do, please kindly subscribe and share. Best wishes. Stay safe, stay healthy. I will talk to you soon. Thank you. Take care. Bye bye.